Hi there, I'm Dr. Aib Kalathur. I'm a board certified internal medicine physician practicing in the United States. Today I'm going to talk about COVID vaccines. I'm going to say a little bit about how each vaccine works so that my viewers, if not vaccinated yet, will be more comfortable getting vaccinated. The two main kind of vaccines available are the mRNA vaccines and vector vaccines. In US, Pfizer and Moderna made COVID vaccines are the mRNA vaccines, and Johnson & Johnson made vaccine is a vector vaccine. The vaccine made by AstraZeneca, which was available in Europe and in India, is also a vector vaccine. In India, the name of the vaccine is Covishield. All these vaccines are found to be safe and efficacious in preventing infections to a good extent, but extremely effective in preventing severe COVID. Now I'm going to talk a little bit about mRNA vaccines. mRNA means messenger RNA. Naturally, in our body, the role of messenger RNA is to carry genetic information from DNA within the nucleus to the ribosomes, which is outside the nucleus where the protein synthesis happens. These messenger RNAs goes into these ribosomes, and these ribosomes make proteins using amino acids, and these proteins are our building blocks. These mRNA or messenger RNA never goes back into your cell nucleus, and once it comes out of it, it never goes back, and hence it cannot alter your DNA or genetic material. Historically, all viral vaccines are made by culturing these viruses and then killing it or weakening it and then injecting those into our body. The purpose of all vaccine is to mimic the infection, following which your body makes something called antibodies to fight this mimicked or false infection as a response. Now, when this patient is exposed to a real virus, the person already has antibody made by the vaccine and hence prevent the infection or at least decrease the severity of the infection. The benefit of messenger RNA vaccine is that we can skip this entire process of virus culturing, weakening it, or killing it. The mRNA vaccines are just a genetic code for the viral protein called spike protein in case of COVID-19. And once we're injected, these messenger RNA goes directly into the ribosomes and make these spike proteins. As soon as our body recognizes this spike protein as an outside protein, which is an amazing thing our body does, it mounts an immune response, making antibodies against the protein and destroys the protein in the process. And in that process, now we have antibodies against COVID spike protein to fight the virus if we are exposed to it. Since we don't have to culture this dangerous SARS-CoV-2 viruses which causes COVID, it is very safe to make these vaccines, and it is very fast. We can make the vaccines very fast. mRNA vaccines are found to be very effective and safe after using against COVID, and hence this could be the vaccine for many diseases in the future. Research have already started to use mRNA vaccines against other infections, for example, malaria. Like I mentioned, these mRNA vaccines are found to be very safe, but even then, extremely rare side effects are seen. One of them is myocarditis and pericarditis, which is inflammation of the heart and its coverings. Happens extremely rarely, mostly seen in boys between the age of 12 to 15, and usually seen 2 weeks after the second dose. Most of these patients needed a hospitalization, but all reports show that these patients recovered without any long-term effects, and no one died from it. The rate of this complication is very small, a few cases per million doses. Like I said, mostly seen in boys. 12 to 15 is extremely rare in ladies and girls. Allergic reaction to COVID-19 is another thing. It happens extremely rarely. And almost all patients receiving this mRNA vaccine would get a fever, body ache, fatigue, and sometimes even diarrhea lasting usually less than 24 hours, never more than 48 hours, and would not cause any respiratory symptoms like sore throat, cough, or shortness of breath. These are normal mRNA vaccine symptoms. These symptoms could develop with the first dose in patients who already had COVID infection prior to vaccination. These normal vaccine symptoms are due to our body's immune response making antibodies against COVID spike protein. Now let's talk about vector vaccines. Like I mentioned before, Johnson & Johnson vaccine as well as AstraZeneca vaccine are vector vaccines. These vaccines are delivering the spike protein in a carrier virus or vector virus. The vector virus used in Johnson & Johnson and AstraZeneca are adenoviruses, which are also common cold viruses. These viruses' DNA are genetically altered in a way that they cannot multiply, they cannot make humans sick, and they cannot integrate or alter our DNA. Genetic code for the synthesis of spike protein of COVID-19 virus is also inserted into these viruses' DNA. And hence, once vaccinated with these vaccines, these viruses goes into our cells, express COVID spike protein in our cells. And what happens after this is the same as the mRNA vaccines. Our body recognizes these spike proteins as foreign to our body, and it immediately destroys them by making antibodies against it. These spike protein antibodies now prevent us from future COVID infections to a good extent, and sometimes to a good extent prevent severe illnesses. One of the downside to this vaccine is immune-mediated blood clot, even though extremely rarely seen. Also, if you had an infection with a similar adenovirus prior to getting vaccinated, the virus given through vaccine would be destroyed right away, and because of that, enough spike protein might not be formed to make enough antibodies. So in a recent observational study, Moderna vaccine prevented hospitalization the best, 93% of the time, Pfizer vaccine 88% of the time, and Johnson & Johnson only 71% of the time. So a few words about dosing of the vaccines. At the time of making this video, a regular dose of Pfizer vaccine is approved for anyone 12 years and above in the United States. First two doses of Pfizer vaccine is given 21 days apart. A third dose of Pfizer vaccine is given in some severely ill patients 1 month after the second dose. These are who are severely ill, for example, who have active cancer, getting chemotherapy, or patients who had organ transplants and who have to take medications to suppress their immune system to prevent rejection of those organs. At the time of making this video, booster dose of Pfizer vaccine is recommended 6 months after the second dose for anyone who is above 65, or if anyone who is above 18 and have multiple serious medical conditions putting at risk for severe COVID illness. It is also recommended for personnel who are at higher risk for exposure, like healthcare workers. At the time of making this video, Moderna vaccine is approved for everyone 18 years and above. The first doses of Moderna vaccines are given 4 weeks apart, and a third dose is recommended for severely ill patients, exactly like in Pfizer vaccine, a month after the second dose. And a booster dose is recommended in the same group of people as I just mentioned for Pfizer vaccine, and it's given 6 months after the second dose. The only difference with Moderna is that the booster dose is half of the first two doses. So Johnson & Johnson vaccine initially came out as a single dose vaccine, but because of its inadequate protection, a booster dose is now recommended with any of the available vaccines, and it is recommended for anyone 18 or above 2 months after the first dose. So unlike Pfizer and Moderna vaccine, there are no restrictions for booster dose for people 18 and above who received a Johnson & Johnson vaccine at the time of making this video. At the time of making this video, Pfizer vaccine received emergency use authorization for children 5 to 11 years old. Dosing intervals are the same as adult, but the dose administered is 1/3 the dose. This is because of good immune response even with smaller doses seen in children. Special circumstances about the vaccination. If someone developed COVID after the first dose of vaccine, you can get the second dose as scheduled as soon as your symptoms from COVID have subsided. If someone developed COVID prior to vaccination, you can start receiving the vaccination series 1 month after your symptoms have subsided. If a person received something called monoclonal antibody treatment after getting COVID, that particular person should wait 3 months before starting to get the vaccination series if not vaccinated yet. So another special circumstance about booster dose. When receiving booster dose, if possible, the same kind of vaccine has to be taken, but some studies done showed that mixing and matching is also efficacious, and hence, if there's a lack of availability of any particular vaccine to get the booster dose, any approved COVID vaccine in the United States can be taken as booster dose, irrespective of the kind of vaccination received for initiation series. Again, we, the medical community, recommend getting any available vaccine who are eligible for it. Okay, so please get vaccinated as soon as possible if you're not. When I try to counsel patients for vaccination, one thing I hear most of the time is they're concerned about potential long-term side effects from the vaccines. I would like to address that in this video because this is a major concern for many patients. Vaccines are usually 1 or 2 doses and the booster dose and done. We may also start getting yearly vaccine for COVID-19, but no one knows that for sure yet. What I'm trying to say is it is not like a blood pressure or diabetic medication which you have to take on a daily basis to cause concern for long-term side effects. So if we put together all the vaccines we've developed so far in modern medicine, none of them have side effects past 30 days of a dose. Most of the rare side effects are immediate, like allergic reactions. Rare side effects like, for example, myocarditis and pericarditis seen in mRNA vaccines happens usually 2 weeks after the second dose. So no side effects after 30 days. So when these vaccines were initially studied because of the potential effect for the 30-day side effect, the studies were done for 60 days. It is true that some of the extremely rare side effects would appear only once given in a large number of people, but these side effects are being closely monitored. That is how we found out about the extremely rare heart inflammation side effect in mRNA vaccines and immune-mediated blood clots in vector vaccines. Now all the vaccines are way past 30 days since it came out, and Pfizer vaccine is now fully approved by FDA for adults. I can't stress enough the fact that the odds of side effects from these vaccines are extremely small compared to the odds of getting severely ill from COVID, even if you're a healthy person. And the odds of long-term issues are also there with severe COVID infection. So don't forget that. Bottom line, please get vaccinated. Subscribe to my channel for future videos and take care.